Good evening, and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Council Member Priscilla Tyson, President Pro Tem and Chair of these committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. This hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation and the committees that I chair. This includes Health and Human Services, Finance, and the Workforce Development Committees. The goal of these hearings is to promote transparency and to provide an opportunity for city residents to learn and to speak on legislation that impacts their lives. There will be on occasion when a committee is not covered because legislation is not always scheduled for each committee. The intent of each hearing is to review legislation that will be on City Council's agenda for the following 2 weeks. Tonight, we will hear information on legislation in Finance and Health and Human Services committees. And presenters this evening include from Health and Human Services, from the Department of Development, Hannah R. Jones, Deputy Director of Community Development. I saw Hannah Reed and just kind of looked up and thought Hannah was there. From the Mayor's Office, from Celebrate One, Ms. Priam is here as a policy advisor. And then the Columbus Public Health, Dr. Mashika Williams-Roberts, the Assistant Health Commissioner and Medical Director. And from the Finance Committee, we have Christopher Long, the Fiscal Manager. Before beginning with the legislation, we have a couple special 2 presentations that we need to have this evening. The first is that we have Mr. John Gregory, and he is a founder of the African American Male Wellness Walk. And I see Mr. Gregory and certainly a number of the individuals that are in chambers tonight. So please feel free to come up to the podium. And I also want to recognize Mr. Gregory. I know that you could not be in chambers last night, but certainly we recognized you with we have a resolution for you in regards to, we had a presentation on it's prostate cancer awareness month is the month of September, and we're out the month of August, and just wanted to present the resolution yesterday. And so I have a resolution that I also want to present to you in regards to Prostate Cancer Awareness Month, as well as tonight you're here to talk about the African American Male Wellness Walk that will be happening August the 12th. The floor is yours.
All right. Thank you. We appreciate the invitation to come and talk about the African American Male Wellness Initiative. This will be our 14th walk in the city of Columbus. We started in 2004, and we started with about 700 men, which was really just a thought. Like, hey, look, we got to go tell black men are dying, and it appears nobody really cares, and so we got to get the message out. The first walk was so overwhelming with 700 people coming, and they said we got to do this again, and here we are in 2017 doing the walk again. The walk is August 12th. We start screenings at 7 o'clock in the morning. We do a 5K official run. You can walk. We have passion teams. We have a kids area. We have everything's free. We have some entertainment. And we are very proud that the City of Columbus this year has really stepped up to the plate. I think they have over 200 people who have signed up to be on the city's passion team. And we are grateful because one of the things that I really kind of like about this, it's an African American male event. It's all the negative stuff that we hear about African American men. This is one event that's very positive, and it happens to be one of the largest events that happens in Central Ohio. We do this event in Cleveland, Toledo, Youngstown, and Cincinnati, and we do it in other cities across the country, but it started here in Columbus. The event is a year-long initiative. We do a mental health event where we call, this year it was called Barbershop Barbershop Talk, Real Men, where we talked about mental health issues in African American men. And then we did a Cooking with Dads program where we paired fathers and their children to come out and learn how to cook healthy. This year at our thank you celebration, where we will be thanking our sponsors, every year we choose a health hero, someone who has advocated on the behalf of African American men's health. And this year we have chosen Councilman Priscilla Tyson to receive one of our Health Hero Awards for her work in the community as it relates to health, particularly around African American men. And so we are so greatly appreciative of your participation every year. And it's really funny. I said I was going to save this and said at the banquet is that I remember how serious Priscilla Tyson knew I was about the health. They were there and they kept telling me, like, we need to start the race because the mayor wants to say something. And I said, well, you know, we're trying to get screenings, so if the mayor has to leave, tell him to leave. And so I thought nobody heard me, and Councilman Tyson came over and said, that's the way to stick with the people. And so I really appreciate you understanding that this whole mission, this whole vision, all what this is about, it's about saving lives. Every year, we have to take a man from the walk to the emergency room. Every year, we have taken somebody from the walk to the emergency room. This really is about saving lives. Our goal this year is to do 500 screenings, to screen 500 men. We usually do about 18 different screenings. Prostate, by this being Prostate Cancer Month, prostate is one of the screenings that we do. And every year, the prostate bus tells us that they screen more men at our event than any other event that they go to. So, Councilman Tyson, we are absolutely grateful. I'm standing with men who have participated and who are excited. We're extremely excited this year because we believe that we're going to exceed our goal. We calculate there's 270-some thousand African Americans in the city of Columbus, and all we're looking for is 20% of those people to come out and walk to continue to spread the message of health to the African American community and African American men. I think I covered everything. One of you guys got something you want to say? There's some young men with me, so they're young, and when they get my age, they'll realize that you got to live for a purpose. And my purpose has been to spread the news that African American men are important, their lives are important, and we ought to be about trying to save them. Anybody else?
I just want to personally say thank you to Mrs. Tyson for your work that you have done in the community. And each year you keep bringing us back. And so we really value for what you have done, your work in the community, and say thank you again.
Thanks again to the council members and you, Ms. Tyson. I appreciate it.
Well, first of all, I just want to say thank you for what you're doing in our community. It's great. Mr. Gregory, thank you for the work that you're doing not only for the African American Male Wellness Walk, saving not only men's lives, but also women's lives, because women are being screened too, but also it's really great to have you standing here with these young African American men. And it's important to see that for our viewing audience, but also the listening audience, to be able to know that there are African American men in this community that are doing really great things and certainly do care about the welfare of African American men, but also just the community as a whole. So I thank each of you for your leadership and the work that you're doing. I appreciate you greatly. I'm also going to give you an opportunity. I think it's also important that you have an opportunity also to just to kind of share your name, and because your family members will see you here, and I think if you've taken the time to come down, and that each of you should come to the podium and say a few words, at least say your name. So, but John, before you move away from the podium, again, I want to I'll come and present you with this resolution that, being a prostate cancer survivor, I just want to say thank you for constantly sharing information about prostate cancer awareness and all the other work that you're doing. So thank you very much. And I'm going to give this to you, and then each of the gentlemen can come and state their names, please.
Perry Gregory, Vice President of Workforce Development, National Center for Urban Solutions.
Narahari Luke, Business Consultant Specialist at the National Center for Urban Solutions, and thankful for being here.
Charles Jefferson, Dean of Students for the Academy for Urban Scholars, and thank you as well, City Council as well, for the support for the African American Male Wellness Walk.
I'm Shay Tolliver. I'm an engagement coach with the Academy of Urban Scholars. This is a legacy that we're, carrying on for Mr. Gregory, and just all that he stands for, and being able to show that other African American men can stand for something like our health and wellness, which we usually don't know for. So.
Antonio Cooperwood, Program Coordinator for the African American Male Wellness Walk, and thank you again.
I am Chad Anderson, the Executive Director of the African American Male Wellness Walk Initiative.
Want to say something else?
Yes, ma'am.
Thank you.
Tiffany Hughes, African American Male Wellness Walk.
Well, thank you for coming down. And again, would you want to just again share what time it's going to start and where the race will kick off and all the health screenings?
Yes, absolutely. The health screenings will start at 7 a.m. sharp, August 12th, 2017 at Livingston Park. That's in front of Children's Hospital. It's very important to also mention that the race will start promptly at 9:30 a.m. and there will be pavilions for screenings, of course, and as well as vendors.
All right, thank you very much. Thank you for coming down. Thank you. And next, we're going to have Yolanda Owens will come to the podium, and certainly the other individuals that she's with will to present a resolution. It will be on the council's agenda on consent on Monday. I will not be at the council meeting on Monday, and that's where we're kind of presenting it today. So this is National Breastfeeding Month, and if you will come up, that would be wonderful. And this is a resolution to declare August of 2017 as National Breastfeeding Awareness Month in the city of Columbus, and remind Columbus residents that breastfeeding is about working together for the common good. And whereas breastfeeding is organized and promoted worldwide by the World Alliance for Breastfeeding Action, the World Health Organization, and UNICEF to improve the health of babies. And whereas optimal nutrition is vital significance in the early months and years of a life and has lifelong impact on health. And whereas exclusive breastfeeding for the first 6 months of life and continued breastfeeding, along with the appropriate complementary feeding at 6 months and beyond, ensures that both the mothers and infants receive the maximum health benefits. And this organization, whereas Black, was founded to help connect women of color to evidence-based information, community resources, and sisterhood through the shared experiences of breastfeeding, thus improving the health of both the mother and the child. And whereas Black will be in celebration with the Black Breastfeeding Week with a community forum on Saturday, August the 19th to kick off working toward lowering the infant mortality rates of children of color in Central Ohio. And whereas the theme of this year's Breastfeeding Awareness Month is working together for the common good, as promotion of this message supports the city's efforts to improve public health in our community. And again, this will be it resolved by the Council of the City of Columbus. We do hereby declare the 2017 August as a National Breastfeeding Awareness Month. And again, this will be presented to, I will present this to you today, but again, there'll be one we'll have it on the council agenda on Monday as a consent item. So the floor is yours, Ms. Owens.
Thank you so much, President Pro Tem Tyson. Myself, Yolanda Owens, as well as Sissy Watkins and Khadijah Adams are all founders of Black Lactation Circle of Central Ohio, also known as Black, and are happy to be able to have the support of Columbus to support Black Breastfeeding Week. Black Breastfeeding Week was created over 40 years, was created because for over 40 years there has been a racial disparity between breastfeeding rates of women of color and white women. The most recent CDC data shows that 75% of white women have ever breastfed versus 58% 28.9% of Black women. That number is halved in 6 months to 30% for African American women. The high infant mortality rates here in Central Ohio show that African American babies are dying at 3 times the rate of their white counterparts. The high infant mortality rate among Black infants is mostly due to their being disproportionately born too small, too sick, or too soon. And these babies need the immunities and natural benefit of breast milk the most. Also, the high rates of diet-related diseases in the African American community. When you look at the health conditions, that breast milk, the most complete first food, has been proven to reduce the risks of African American children for them the most. Now Sissy has a few points as well.
Thank you. The unique cultural barriers among Black women. So many of the women fall into a booby trap. Breastfeeding is universal, but when it comes to Black women, we have a unique cultural barrier, a complex history connecting to breastfeeding, from our role as wet nurses in slavery and being forced to breastfeed and nurture our slave owner children, often to the detriment of our own children, to the lack of mainstream role models, as well as a multi-generational support, to our own stereotype within our community. We have different dialogues around breastfeeding, and it needs special attention, and it's not being given. Oh, your notes, that's right, sorry.
Our women also are much more likely to be in communities that are desert-like with regard to breastfeeding. So most, I won't say most, but many, many Black women in Columbus, when they are choosing to make the decision to breastfeed, they're the only person in their family or friend circle who is breastfeeding. There's no wisdom for them to glean from the community that they come from. There's also a real lack of diversity in the lactation field in general. One of the reasons we ended up coming together as a group in the first place, we were 5 ordinary women who have no real professional background in lactation, who found resources, got excited, met one another in an online forum, and decided to put some feet on that community that we found ourselves in need of for other folks. This is why we believe that it's so important that there be evidence-based information for women on their breastfeeding journeys. We're so excited to be here. We are missing our 4th founder today. She is off with her 2 well-breastfed babies and her husband on vacation, so she sends her greetings. And again, we are so excited that you gave us the opportunity to recognize not just the week, but the 300 women who we have right now, encouraging one another to do what is best for their babies.
Again, I have the resolution for you, and I want to say thank you. You know, you should never doubt when a small group of women come together, they can change the world. That's what Margaret Mead said. And so you have 4 women who have come together. They saw a need in our community and are changing the world for our babies and for our families. And so again, thank the 4th founder that couldn't be here tonight, but certainly appreciate you guys coming together to be able to now work with 300 women of color in our community and to help them to be able to have them to be healthy as well as your baby. So thank you very much.
Thank you.
Don't leave, get your resolution.
You get the longest one.
All right, I will now begin with legislation in the Health and Human Services Committee and ask Hannah Jones to present legislation from the Department of Development. The floor is yours.
Good evening, President Pro Tem Tyson. For your consideration this evening, we have 3 ordinances. The first is Ordinance 2103-2017. And while I'm describing it, I would like to invite Tim Sword, who serves as the Executive Director of Sister Cities, to make his way to the podium. The ordinance before you this evening is to allocate $7,500 to support Columbus Sister Cities and the work that they are doing to support activities that bolster our sister city relationship with Genoa, and I will pass it over to the Executive Director to discuss.
Great.
Good evening, Tim. How are you?
Great. Councilmember, how are you?
Thank you.
Sure. Appreciate support for this legislation as it gives us some support to continue the exchanges that we started on your trip with young professionals to mark the 60th anniversary of our first sister city, which was Genoa, Italy. During that trip, we discovered a number of opportunities, namely the pesto. Pesto is from Genoa, and that they had an organization that held an annual or biannual competition, World Championship, and they had suggested to us that we could have a regional competition. As far as I know, the only other U.S. communities that have offered this opportunity through this organization were in New York and Los Angeles, so I think that puts us in the right company. But also we're looking at supporting the Paganini violin, which is the over 250-year-old violin. He was known as the devil's violinist because he played so radically and upset the world through music. But also put Genoa on the map. Additionally, we met a photographer, Timothy Costa. He did a current modern portrait of Genoa. It was 1,000 people of Genoa, and he's looking to display that here. Both our counterpart from Genoa, Gianluca, and the artist came last October to the Sister City annual luncheon at the State House, and you had met with them a couple times during that visit as follow-up, which has created the momentum. These funds will definitely support our effort most immediately for the pesto competition, which will do many things, including connect new organizations to our relationships and making them more valuable, but additionally allowing citizens to get more involved with sister cities through participation, through applying to be one of the 10 finalists here in Columbus that will compete to get expense-paid trip or all expense-paid trip to Genoa in March of next year, to compete with 99 other competitors in the World Championship that happens every other year. And I just want to make a note that you have taken strong leadership on this, and I recall meeting you the first time and saying, Tim, I understand how sister cities get together, mayor to mayor, but it takes the community to get involved to make those relationships valuable, and you've taken leadership to make sure that it happens as much as you can. And the other council members have been supportive as well, and Councilmember Hardin's traveled with us to Accra with the mayor. The mayor's office has been very supportive as well. But your whole staff's been supportive, by the way. But without Matt Erickson, I don't think we would be where we are in any of these exchanges, and he needs to be highlighted and thanked.
Thank you, Tim, for certainly coming down. And for the audience that doesn't, listening and viewing us, that may not know what Sister Cities is, can you just briefly share what Sister Cities is and the important role that it plays in our community?
I'm not very good at brief, but I'll try. So President Eisenhower actually set up Sister Cities program during his administration, so it's over 60 years old. And the whole idea is people-to-people exchange, not dissimilar from the Peace Corps and other organizations like that. But the idea is that by connecting more people, we're going to have more success in international diplomacy and sharing the best practices that each of our cultures and countries have, but also ultimately, hopefully, to avert conflict and war. We'll probably never eliminate it. It's just a human condition, I'm afraid. However, we can reduce that, I think, through people exchange. It's so easy to get, sidetracked a little bit on the messaging when all you're getting it from is the news media. But when you go to places, and I won't name them, but places that maybe we look at as conflict places, you realize they're the same as us. They're trying to educate their kids and feed their kids, do the best they can for their community, but for many reasons out of individuals' hands, they're in those situations. By reaching out to them and forming real community, we can show compassion, share the best of what we have, but also, perhaps benefit our own community for sure, not by only seeing the world as more than Columbus, but also can we identify 21st century global challenges like infant mortality, where Curitiba, for example, our sister city in Brazil, has dramatically improved their numbers in the last 15 years. We need to connect and figure out, what did they do? Is that something that we can apply to portions of our community where that's a serious concern?
Thank you, Tim, for coming down, and certainly overall we have an investment. This is the Development Department for Sister Cities, and certainly focusing on arts, culture, economic development. That's why we have a relationship with sister cities. And again, we just mentioned that Genoa is our oldest sister city. It was formalized in 1955. And to continue to move this relationship forward, this legislation is for $7,500 to be able to support the programming that is necessary to continue working with sister cities and to build the relationship with the city of Genoa. And it will be presented to the council members on the floor on Monday. Thank you for coming down. Thank you for your leadership. And again, I want to thank the whole team that's been working, not only the team from City Council, but certainly in this relationship. I want to thank GCAC, the Columbus Museum of Art. I want to thank the Recreation and Parks, our Cultural Arts Center. I'm trying to think of it, the Symphony, the CSO. Absolutely. So there are a lot of people who are going to be really working with this relationship with Genoa, and just want to thank them for their leadership.
And the Italian Festival.
And
too.
the Italian Festival,
Exactly.
absolutely.
Great.
Absolutely.
Thank you
All
again.
right. Thank you very much.
The next ordinance we have for your consideration this evening is 2046-2017, and while I'm describing it, I would like to invite Andrea Oman, who serves as the Director of Data and Grants Management for Life Care Alliance, to the podium. This ordinance is to allocate $25,000 to Life Care Alliance. It is to promote the work of the Central Ohio Diabetes Association and their detection and outreach program that they do with Life Care Alliance. And I will turn it over to Andrea to discuss the program.
Hello. On behalf of the Central Ohio Diabetes Association, I want to say thank you to President Pro Tem Tyson and City Council for the past support of the Central Ohio Diabetes Association, also known as CODA. CODA helps individuals living with diabetes detect their condition, prevent onset and complications, and learn to live well with the challenge of diabetes. The program provides diabetes and nutrition education, community detection programs to identify undetected or uncontrolled diabetes, camp and youth programs for children with diabetes, community outreach programs to high-risk populations, and financial resources information and informational support programs. In 2017, CODA merged into Life Care Alliance. The goal of this partnership is to expand service to more clients, to ensure that clients have increased access to critical health care, and to continue the comprehensive health care services currently provided by CODA. This merger will prevent the need for Life Care Alliance's health and nutrition services to older adults and individuals living with a medical challenge or disability in order to avoid future waiting lists. As these services become increasingly in demand with the growth of the senior population, this is vital to the health and well-being of the Central Ohio community and its residents. The City of Columbus Detection and Outreach Program provides access to community-based diabetes prevention and detection programs, affordable diabetes education, and lifestyle support programs. Because of CODA's recent merger into Life Care Alliance, the program will now have an expanded population to serve through its detection and outreach efforts. Many clients in Life Care Alliance's programs, such as Meals on Wheels, may have undetected or uncontrolled diabetes. Furthermore, clients of Life Care Alliance often have multiple chronic health conditions, which can place them in the high-risk category for diabetes. CODA now has the opportunity to expand its services to homebound older adults and vulnerable individuals who may otherwise not have access to this diabetes education and detection. The program funded by the City of Columbus will provide screening to thousands of people with undetected and uncontrolled diabetes, while also linking them with diabetes resources in our communities. Individuals in these low-income and high-risk communities will receive community-based diabetes and prevention education, healthy lifestyle programs, and cooking demonstrations from CODA's clinical staff. The target communities include the following areas based on the certain zip codes: Wineland Park, Near East, Old Town East, South Side, North and South Linden, Downtown, North Central, Hilltop Franklinton, Northland, and many other areas within the City of Columbus. Specific outcomes tied to the proposed $25,000 funding include providing 2,900 individuals with blood glucose screenings throughout the funding year, participating in 165 screening events throughout the region, centering on high-risk locations such as senior living facilities, Somali community-specific, and LGBTQ community-specific locations. 100% of those who screen abnormal during one of CODA's screening events or who have indicated that they have high risk factors for diabetes will receive a pre-diabetes packet, referral, and follow-up services. And CODA will also host 5 community-based diabetes prevention and management workshops in high-risk community settings previously mentioned. I want to thank President Pro Tem Tyson and the members of council for considering this legislation, and we thank you for your support of the so many people that we serve in the City of Columbus.
Thank you for coming down and certainly sharing how the $25,000 will be utilized to support individuals in our community. I think it's a good alliance between Life Care Alliance and the Central Ohio Diabetes Association, and you just outlined the importance of that relationship. As we, every April, we have a hearing on Minority Health Month to focus on some of the areas in our community that tend to have disparities in terms of minority health, and certainly diabetes is one of the areas where there's a great disparity. And so this, again, I see as an opportunity to be able to help reach those individuals and hopefully begin to help to improve their quality of life through the programs that that CODA has. And so, again, as you just mentioned, I think it's an important relationship to be able to go to those homebound individuals, to be able to provide them with the information that they need and be able to, hopefully, if they don't have the disease, prevent them from getting it. If they do have the disease, to be able to have them eat the proper foods to help to enhance their overall quality of life. So again, thank you for coming down. I appreciate the work that CODA is doing, and look forward to this legislation being on the council agenda on Monday.
Thank you very much.
So much.
The last ordinance we have for your consideration this evening is Ordinance 2050-2017, and it is to allocate $20,000 to support the work of the Community Kitchen. The Community Kitchen's primary service is to feed hungry families and individuals throughout the City of Columbus region. They do this by providing a free hot breakfast and noon meals 6 days a week out of their location off of South Ohio. They also offer hot breakfast and lunch 5 days a week at their satellite location, which is St. Dominic's Church. On average, they serve 200 to 250 persons daily, and that can increase to up to 350 people by the end of the month due to other resources being exhausted by our residents. In 2017, the objectives through the end of this year is to serve 150,000 people breakfast and lunch, to serve at least 10,000 meals to children specifically, and to continue to focus on family and children activities and nutrition that support the residents of the City of Columbus.
Thank you for, again, sharing this legislation, and pleased to be able to support this to make sure that individuals in our community have access to food. Breakfast and, as you mentioned, breakfast and lunch. 10,000 meals will be served. So 10,000 meals for children will be served. And this really, I visited the Community Kitchen numerous times, and there are also a number of even veterans that go to have lunch or breakfast at this particular facility. This legislation is important in terms of, you think about the food plan that we have in the City of Columbus. We want to make sure that everyone has access to food, and so again, by supporting the Community Kitchen, we're again ensuring that our community members have access to food. And so I'm happy to be able to provide this funding. I know that the United Way is also providing funding, as well as the Columbus Foundation, in support also of the Community Kitchen. So look forward to presenting this to my council colleagues. So this will be on the council agenda on Monday.
Yes,
Thank you very much.
And that is all the ordinances I have for this evening.
Thank you. And now, presenting next is Priam Chosky on behalf of Celebrate One. The floor is yours.
Thank you, President Pro Tem Tyson. I'm here on behalf of Celebrate One as the Director of Community and Legislative Strategies, and I would like to present two ordinances this evening for your consideration. The first one, 1951-2017, and this is to authorize and direct the Mayor's Office to modify an existing contract with St. Stephen's Community House to allow continued work in the reduction of infant mortality in the Linden and Near East community through December 31st, 2017, and to authorize the expenditure of $18,412 from the city's private grants fund. As you know, this ordinance speaks to our connectors and the work that they're doing in our Linden and nearest communities, connecting pregnant women and their families to resources. So it's essentially extending funds for St. Stephen's to make sure they get paid.
Thank you, and certainly realize the importance of this work and the importance of the community connectors, making sure that individuals will be connected to the resources that are needed for them to continue to want to have a healthy baby and then to follow that baby for at least their first year of their lives. And so this will help us to reduce infant mortality in our community. Just appreciate the mayor's office's focus on this particular issue. And again, look forward to my council colleagues supporting this legislation on Monday. Thank you.
Thank you. The second ordinance I have is 2013-2017, and this is to authorize and direct the mayor's office to modify an existing contract with St. Stephen's Community House to allow continued work in the reduction of infant mortality in the Linden community through June 30th, 2018. And this contract supports the work of our Linden intervention lead, Delina Scales, and the intervention that's taking place in that community, the Celebrate Linden app. As to date, I believe we have over 400 users, active users. Our goal is 500 by end of the year, and I think we'll be well over 1,000. We've kind of doubled that goal for her. I think we could do it. This is a community and evidence-informed intervention. It's co-created with the community because of resources that they identified they were not aware of or identified they needed for community cohesiveness. That is all.
Thank you. Again, this is again mentioned in Linden, and Delina's doing a really great job. I know that I was out every Saturday now. They're having programming in the month, well, they did in the month of July on Saturdays to having a neighborhood event, and Delina is certainly out there making sure that the community knows about all the resources that are in the community, sharing resources that may be outside the community that will benefit the community, and making really a great representation. So look forward to this information. Look forward to this legislation being on the agenda on Monday. Thank you very much.
Great, thank you.
Thank you. And then in Health and Human Services, I now will ask Dr. Mashika Williams-Roberts to present her legislation from Public Health.
Thank you and good evening. We have 4 items for your consideration this evening. The first is ordinance number 1988-2017, and this is to accept and appropriate tobacco use prevention and cessation grant. Columbus Public Health has been awarded this grant from the Ohio Department of Health. This ordinance is needed to accept and appropriate the $110,000 in grant monies to fund the tobacco use prevention and cessation grant period for the period from for the period from July 1st, 2017 to June 30th, 2018.
Thank you. And Dr. Roberts, how will this funding be used to support the Tobacco 21 efforts?
So a small portion of these funds will be used to support the work we're doing around Tobacco 21. Obviously, we're going to need to do a lot of community outreach and education about Tobacco 21, and so some of these funds will be used for that. But the remainder of the funds will be used to help with smoking cessation and reducing smoking in multi-family housing units.
I think and the reason I was asking that, because if there are individuals who are smoking that were between the ages that were focused on with Tobacco 21, these programs could also help them.
And I should note that this, we're going to really concentrate some of our work for this grant in the Linden, Southside, and West Side neighborhoods as well. So multifamily housing units in that area, as well as schools in those neighborhoods, will be targeted with this grant.
Thank you very much.
The next ordinance we have is ordinance number 1989-2017. It's to contract with Comp Drug Incorporated for youth tobacco use prevention and cessation services. It is necessary for Columbus Public Health to enter into a contract with Comp Drug Incorporated to provide youth tobacco use prevention and cessation services. This ordinance is needed to authorize the Board of Health to enter into a contract for the amount not to exceed $60,000 for the period of July 1st, 2017 through June 30th, 2018. And the purpose of this contract is to fulfill the deliverables for the youth objectives related to tobacco use prevention and cessation grant awarded by the Ohio Department of Health.
Thank you.
The next ordinance we have is ordinance 1978-2017, and this is to accept and appropriate the Minority Health 2017 to 2018 grant revision. Columbus Public Health has been awarded a continuation grant from the Ohio Commission on Minority Health, which was ordinance 1075-2017, which was passed by City Council and approved by the Board of Health, to accept and appropriate $42,500 in grant monies to fund the Minority Health Grant Program for the period of July 1, 2017 through June 30th, 2018. The Ohio Commission on Minority Health has revised and increased the award by $10,000 for the same program period. This Minority Health Grant Program enables Columbus Public Health to work to eliminate differences in health status between racial and ethnic minority and non-minority population by providing leadership and guidance on the best ways to address racial and ethnic health disparity and specific health needs of racial and ethnic minority groups.
Thank you. Certainly, I would thank Director Dawson and her team for providing our team an additional $10,000 to do the work, to focus on the disparities within the minority community in regards to health care. And I'm sure the team will be excited to get these additional dollars. And I know Director Dawson was here at the hearing that in April that certainly Ryan Johnson, Mr. Ryan Johnson led that effort, and just really appreciate the information that they shared. And I know she appreciated all the organizations that came down and shared the work that they're doing. So excited to get this additional $10,000 to support the efforts at Columbus Public Health.
Absolutely, and definitely a needed resource for our community. So thank you for that. The last ordinance we have is ordinance number 2010-2017 to accept and appropriate Moms Quit for Two grant. Columbus Public Health has been awarded a grant from the Ohio Department of Health. This ordinance is needed to accept and appropriate $63,533 in grant monies to fund the Moms Quit for Two grant program for the period of July 1, 2017 through June 30th, 2018. The purpose of the Moms Quit for Two program is to increase smoking cessation rates among pregnant and postpartum women by offering individualized tobacco cessation treatment, monitoring progress, and providing incentives for remaining smoke-free. This program aims to improve birth outcomes, reduce low birth weights and preterm birth rates, and increase overall quit rates as part of a larger strategy to reduce infant mortality.
Thank you. I'm very excited that Columbus Public Health was awarded these dollars. It is so important that for providing, and this grant provides what I like, individualized tobacco cessation treatment for our moms, because we want to reduce SIDS in our community. We know smoking certainly plays a role in SIDS. And again, the role, and again, as you said, just focusing on the Celebrate One work. And so excited to get the $63,000. Thank you very much.
Absolutely, thank you.
I would like to transition to legislation in the Finance Committee and ask Christopher Long to cover legislation from the Finance Department.
Good evening, President Pro Tem Tyson.
Good evening.
Tonight we have 13 ordinances for your consideration. The first is Ordinance 1897-2017, and this seeks authority for the Finance and Management Director to establish 3 universal term contracts for specialty automotive and equipment parts and services for use by our Fleet Management Division. These are sole source universal term contracts, as these 3 individual vendors are the only local distributor of the needed parts.
Thank you. And the total estimated spend is $110,000.
That's correct.
All right. Thank you.
Our next ordinance for your consideration is Ordinance 1968-2017. This seeks authority for the Finance and Management Director to enter into a universal term contract for the purchase of irrigation parts with Site One Landscape LLC. This would be used by the Department of Recreation and Parks. And this was competitively bid.
Thank you. And the estimated spend is $30,000. I don't have any questions.
Thank you. Our next ordinance is Ordinance 1977-2017. This seeks authority for the Finance and Management Director to essentially bill certain capital eligible labor costs associated with our construction management group to various capital projects. So this is an ordinance that we typically do once or twice a year, and this is our sort of phase 1 of that legislation for this year.
Thank you. And so this is for $225,000. And excuse me, last year, I think we reimbursed $700,000 was reimbursed for staff work on capital projects. Do we? So we expect more ordinances to come throughout the rest of this year?
Yes, that's correct.
Okay. Thank you.
Our next ordinance is Ordinance 1984-2017, and this seeks authority for the Finance and Management Director on behalf of the Fleet Management Division to establish purchase orders for vehicle rental services with Enterprise Holdings Incorporated from a previously established State of Ohio cooperative contract. And earlier this year, we sought authority to purchase vehicle rental services from a universal term contract established by the city. We just found that State of Ohio cooperative contract pricing was actually lower. So this seeks authority to kind of switch the contract to a State of Ohio cooperative contract. I think the annual cost savings will be about $15,000. So that's our request on that.
Thank you. Certainly appreciate the Finance and Management Department for realizing that the state contract, the state term contract, would be better than the legislation that we had already passed previously, and that this will, again, is saving the $15,000, which I appreciate the savings. And can you just really, who are the primary users of rental vehicles?
Sure. The primary users would be Recreation and Parks Department, largely for its summer programming, and then also the Department of Public Safety for certain public safety and covert vehicles.
Thank you.
Our next ordinance for your consideration is Ordinance 1990-2017. This seeks authority for the Finance and Management Director to enter into a voluntary disclosure agreement with the State of Ohio for the purpose of paying State of Ohio sales use and tax, sales tax and usage. It's assessed at about a 7.5% rate on all compressed natural gas that we sell to the general public. For several years, we did not believe that we were subject to that tax. We had various meetings with the officials with the state of Ohio, and it's their interpretation that compressed natural gas falls under their definition of tangible personal property. So we actually approached them for clarification, and as such, we just wanted the authority from council to, pay any accrued taxes and then obviously pay those going forward.
And so with the explanation you just shared, I know that this is going back to 2014, correct? And that, and the amount that we would be paying to the state of Ohio would be $150,000. And then going forward, I think our annual liability is about $70,000. Now, would that be the same based upon, we're going to open up a new station, couple new stations. So we have the one on the Georgesville station. Will that allow, again, for the public to be able to utilize that station or not?
It will. My understanding is both at the joint use station with CODA on McKinley and then also at our new Georgesville fueling location, that both of those locations will make available to the public the purchase of compressed natural gas. So you're absolutely correct, President Pro Tem Tyson. That number will go up.
Okay.
And obviously, depending on how often and how much usage those stations get from the general public, we'll be able to give you a better idea probably next year how much that sales and use tax number will increase.
Thank you.
Our next ordinance is Ordinance 1993-2017. This seeks authority for the Finance and Management Director to enter into a universal contract for the option to purchase patrol mountain bicycles for the Department of Public Safety with a vendor by the name of Volcanic Manufacturing, LLC. This also seeks the waiver of competitive bidding as a result of the RFP process.
And can you share why we're awaiting competitive bidding on this?
I believe it's that RFPs are typically reserved for services. This is an RFP for goods, and I believe, which is typically rare. But in this case, my understanding is that the Division of Police wanted a little bit more information about what was available to them in terms of new technology for these particular bicycles, and so they opened it up as an RFP process on goods, and therefore the request to waive.
And this for $75,000. Okay. And I know that one of my council colleagues is also looking to purchase additional bikes. Okay. For the police bikes. Okay. Thank you.
Our next ordinance is Ordinance 1995-2017. This seeks authority to modify and extend an existing sole source option contract with Itron, which is a sole source provider for the maintenance of a data capturing system that's used by the Division of Power and the Division of Water, essentially for capturing meter reading and billing information.
Thank you. And this will be for approximately $600,000.
That's correct.
Thank you.
The next ordinance is Ordinance 2009-2017. This seeks authority to modify and extend an existing contract for the continued purchase of process control computer maintenance from Schneider Electric Systems. They essentially maintain an existing UTC for software and hardware associated with the monitor and control flows of water throughout the city.
And this is for $275,000, but this is a short-term 4-month extension until the new contract is prepared. Is that correct?
That is correct.
And do you have any sense of how the new contract will differ from the one we've had presently?
I don't offhand, but I'm happy to check into that for you and get you that information.
Okay, thank you.
Our next ordinance, Ordinance 2012-2017, just seeks authority to essentially API Holdings changed its federal tax ID number. And so this seeks authority to modify past, present, and future contracts and purchase orders just to recognize the change in that federal tax ID number for API Holdings.
Thank you.
Ordinance 2030 is our next, -2017 is our next ordinance for your consideration. This seeks authority for the Finance and Management Director to execute a lease agreement with AARP Foundation for office space lease at 1393 East Broad Street.
Thank you. And this would allow for, they've been renting there since 2007, and $22,500 annually we receive in rent payments. And we rent quite a bit in that building. We do rent this city-owned space to outside organizations. Can you just share a little bit about how the Real Estate Management Office determines our rental rates?
Sure. Our real estate management group, they subscribe to an online service. I believe it's called Lease Harbor, but it essentially allows them to access current market rates, not only for the sale and purchase of real estate, but also for what current office lease rates are around the city in Central Ohio. So they use that as a proxy to assist them in setting lease rates on behalf of the city.
Thank you.
Our next ordinance, Ordinance 2068-2017, seeks authority for the Finance and Management Director to enter into contract for the option to purchase ADS flow monitoring parts and services with ADS LLC. This will be a universal term contract that would be used largely by the Division of Water for to monitor the flow of stormwater throughout the city's sewage system.
Thank you.
Our next ordinance, Ordinance 2090-2017, seeks authority to establish 2 universal term contracts for the option to purchase toter refuse container parts with best equipment and Victory Stanley can liners with Victor Stanley Incorporated. We should note that these are sole source universal term contracts, as these were the only vendors that could supply these parts locally.
Thank you. And we just yesterday passed the legislation to buy new refuge containers, and we knew that there would be another ordinance coming through to be able to add the replacements and parts for our refuge bins, and this is what this legislation is, and there will be up to $50,000.
That's correct.
Thank you.
Our last ordinance for your consideration this evening is Ordinance 2105-2017. This seeks authority for the Finance and Management Director to enter into contracts for the option to purchase personal safety products with multiple vendors, Genco Safety Supply, Applied Industrial Technologies, Granger, and Fastenal, and Wesco. And it also seeks to waive the competitive bidding provisions of Columbus City Code. The reason for that being is that several vendors are offering the same types of products. For instance, Granger and Fastenal have some overlap. And in those instances, in order to award the same type of product to multiple vendors, we have to seek a waiver of those competitive bidding provisions. These would be things, President Pro Tem Tyson, that will be offered through the city's new internal catalog for all departments and divisions to order personal safety products.
Thank you very much, and the estimated spend is about $300,000.
That's correct.
Thank you. All right, so before I end tonight's hearing, I just want to make a announcement in regards to the produce market announcement. And I know that also this Thursday, I think it starts at, is it
10 o'clock.
At 10 o'clock, thank you. This Thursday at 10 o'clock at Columbus Public Health, we'll have the opening of the first farmers market for 2017. So certainly wanting the viewing and listening audience to certainly come out to the farmers market. It's come out and get some great produce and fruit from some of the, greatest vendors in our community. So it's always a great time, and just please come out. Also, my intern, Jordan Harrison, who was just in council chambers, he is, we have an announcement that he has put together, making sure that we have a healthier Columbus is certainly, and one of the ways of having a healthier Columbus is that this week also, in terms of the produce markets that we have in our city, and the City of Columbus is funding produce markets through our funding of human services. And this week and on Wednesday, there will be at Broad Street Presbyterian Church on 760 East Broad Street at 4 p.m. Come out and get free produce. On Thursday at the Dodge Multi-Generational Center, which is one of the Recreation Parks facilities, at 4 p.m. on Thursday. The Linden Recreation Center at 1254 Briarwood on Friday the 28th, again at 4 p.m. And the Corinthian Missionary Baptist Church on East Fifth Avenue on Saturday, July the 29th at 9 a.m. So please go out. The food, the produce, and the vegetable, the produce and the fruit is all free. So please go out to any of these organizations, to any of these facilities, and be able to get some free produce. And again, hope that this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health and the Department of Development, as well as the finance-related legislation that's necessary to support our ongoing city operations. As residents, these hearings are an opportunity for you to learn and become engaged in issues that are presented. I'd like to thank this evening's presenters from the Department of Development, Hannah R. Jones, the Deputy Director of Community Development, from the Mayor's Office, Celebrate One, who's a policy advisor in the Mayor's Office, is Priyam Shatsky. Thank you very much for your service on Celebrate One. From Columbus Public Health, Dr. Mashika Williams-Roberts, our Assistant Health Commissioner and our Medical Director. From Finance and Management, Christopher Long, our Fiscal Manager. And from City Council's Legislative Research Office, Michael Kessler, who leads the office. Matt Erickson, who staffs the Finance Committee. Alexis Pennell, who staffs Health and Human Services Committee. Nancy Pryor-Sully, who is part of our Council's Community Engagement Team. But I always thank my staff, Nicole Harper and Carl Williams, and again, Jordan Harrison, who's our summer intern, and the hardworking team of CTV who make these hearings possible. And finally, I want to always thank the residents who allow each of us that are from council and the administration that allow us to come to work for them every single day and make our city the best place in the country to live, work, and to raise a family. Thank you very much, and the hearing is adjourned.